This is Sean with USA MedBed, and we're doing another video on the Hill Rom P7500 Progressa bed. Now, we've done a lot of videos with this bed. This is the best hospital bed made on the planet, and it comes with different versions of the mattress. You have a foam mattress, you have an air mattress, with low air loss, and then you have the pulmonary mattress, which is the bed that we've got here. We actually have the bed right now in a turn assist feature, and what it's doing, as you can see here, is it's basically turning the person to their right hand side. So you can turn them to the left, turn them to the right, but what we're going to do in this video is we're going to go through the features on the control board to give you a little bit more in-depth information about what the bed can do. And we'll start off first here with going into the mattress settings. Now you can see we have it set up on right turn assist, and turn assist right basically means that you're turning the patient to their right hand side. Now this is going to run right now for about another 21 minutes. Initially it was set for 30. You can stop it at any time, but this is ideal for taking care of patients who need to be bathed or need to have the bed linens changed out. So this is one of the features. We can go back to left turn assist and reset it. And you'll see what it's going to do is it's going to basically reset, deflate one side of the mattress, reinflate the other side. And so that is what's actually happening right now. So we're going to go ahead and let it do that. But in the mode of being able to do that, we can talk about other features. Normal obviously is normal. Max inflate is a feature you're going to use when it comes time to get in and out of bed. What it does is it maxes out the air bladders and inflates all the air bladders so that it makes it easier to get the person off the bed. They don't sink down quite as far. And so that's a feature right there that's going to make it ideal for getting in and out of bed. Sleep mode is going to run the bed in a quieter version. And so the sleep mode, if you're sensitive to noise, that's a fantastic option right there to run in the evening to make the bed more quiet. And then you do have OptiRest, and then you do have the patient comfort, which is actually a great feature because you can determine the firmness of the mattress. And so this is one section right here with some of the controls that you've got. We'll go over to our control panel once again, just to go through that. You've got your full chair position. This literally puts your feet right on the ground. This is the only bed that we've got that has an air mattress system that can do that. And also a foam mattress where you're sitting straight up and down in the chair. You have the boost feature that helps bring the person up if there's ever an issue with the person sliding down in bed. And you can see the other features, they are all pretty standard. Now we're going to get into what makes this bed special, because the features we just looked at on this particular mattress are also going to be the same ones you're going to get on the treatment bed surface, which is the blue mattress right there. So now we also have the features that really stand out, make this bed special. The first one we've got is percussion vibration. So the percussion vibration is basically going to replicate what a respiratory therapist would do with the bed. This particular model right here, the P7500 with the pulmonary mattress, is going to have low, medium, and high. And it's going to have different settings depending on how firm or how many percussions you want and how firm you want the percussion and the vibration settings to be. And you can see they're very, very easy to use. And then you also have the duration on how long you want it to run for. So that's very, very easy to do. And then we're going to just go ahead and back out of that. And then you have the rotation. So there's a difference between lateral rotation and turn assist. Lateral rotation is going to go all night long. So with turn assist, it'll run for up to 30 minutes. And then it's going to stop, and that's all you're going to get. With lateral rotation, it's going to turn the person all night long until you say stop. So you can determine here, you can see I'm going through the settings. I can determine how often I want the person turned, and I can also determine what degree of angle. So if I decide I want a 60-degree turn, I can do 60. If that's a little bit too much, then I can pull that back a little bit, and we can make that 30. So we have the ability there to go through and basically turn the bed at certain angles that are comfortable for the person. In a clinical setting, ballpark, it's usually going to be about a 40 to 50 degree turn. So that's going to be a turn that's going to be about the average, but it's all about the comfort of the person and the comfort of the patient. So that can also be determined by by the person that's actually in bed. And then we've got the scale option here where you can zero out the scale, put a person in bed, and then you've got the options here for being able to determine, weight and do the scale. And then you have the bed exit alarm, which probably is not going to be used all that much, but that's going to determine if the person's in a position where the nurse says you have to have a 30-degree angle. Head angle alarm basically is for cardiac-related patients. People that have cardiac-related issues normally need to be at a 30-degree angle or higher. And then obviously there's going to be the actual person getting out of bed, because obviously if they have an IV or they're in a hospital setting, or if it's even, somebody that sleepwalks or has dementia or any other types of things, you want to be alerted if the person's getting out of bed and you don't want them out of bed. So the Hill Rom Progressa, as we've said many times, is the best hospital bed made on the planet. This is a real overview here of some of the controls, some of the settings. It's really nice to see how easy it is to use. And if you don't need those settings and you just need it in a chair, you can get it with the foam mattress, and you can also go ahead and get the treatment version of the bed right there as well. So for more information, give us a call. Mr. Hospital Bed here, giving you a walkthrough. You can reach us in our San Diego, California location, 858-263-4894. Richmond, Virginia, 804-495-0770. And then also go to our website, which is mrhospitalbed.com. We also have another website, which is hospitalbedshop.com. But if you're looking for a fully electric medical bed, we sell hospital beds new and refurbished from Hill Rom, Stryker, Drive, and other major manufacturers. We are your one-stop shop. We sell over the bed tables, Hoyer lifts, and everything else. Over 15 years of doing this. We sell hospital beds by the thousands, and we ship them all over the United States and all over the world. So for more information on the Hill Rom Progressa, or to order a Hill Rom Progressa, give us a call. We're more than happy to speak to you. And we can also provide other bed options available. From beautiful Richmond, Virginia, this is Mr. Hospital Bed, Sean Callahan, giving you an overview on the control panel and features of the Progressa P7500. Subscribe and share, and we'll see you on the next video.